it's not really a panel. We'll do it as a quick presentation from the next presenter so that we can hear from them. And in the spirit of fairness, we'll go online. One of our presenters is online, so we'll start with our presenter online. That's Dr. Bahaa Eddine Sarroukh. If we can just prep him to be ready for the presentation. So this next session, we are talking about moving from ideas to impact. How policy can accelerate the uptake of innovations into the public healthcare system in Kenya. Mic, perfect. Now I can hear myself. That means you can all hear me. So I'll just take that again. We'll move online to Dr. Bahaa Eddine Sarroukh. Please let's have Dr. ready to take us through his presentation. This will make it short and sweet, where we hear about moving from ideas to impact. We'll get to hear from real life experiences and some of the things that we can pick from the speakers about how policy can help accelerate the uptake of innovations into the public healthcare system in Kenya. Dr. Sarroukh is a senior advisor on innovation and technology to SDG Partnership Platform Kenya and innovation lead at the Phillips Foundation SDG Partnership Platform. We talk about reimagining development assistance, how the SDG Partnership Platform is working with partners to support establishment of effective and sustainable partnerships in healthcare. Do we have Dr. Sarroukh ready?
Yes.
Okay, Dr. the floor is yours. Karibu.
Thank you, and good morning to you all. And really pleased to listen actually to the first interventions already, and of course happy to share with you what we are doing, let's say, as SDG Partnership Platform Kenya. And allow me not to use slides, but just actually to be also a bit brief and just actually build on what has been said by our chief guests and also by the colleagues. And I think we all agree that that we are sitting on many innovations and ideas. And I think we also all agree about the kind of challenges we are facing, but also the opportunities that can be actually matching. So we have as much, I would say, opportunities as challenges that we can see, and we can maybe spend the whole day discussing them, but we can also think about on how to mobilize them and act on them. And I think we all agree that moving from an idea to impact requires innovative models that leapfrog the way we do things, and it is all about flipping the orthodoxy, right? I think there is no doubt that Kenya is pioneering in this space, and we have seen that, and we have been living that, despite the challenges that we have been facing. And so with the setbacks of the pandemic and a number of challenges that we see indeed when it comes, for example, to the supply of the commodities. And the SDG Partnership Platform, Kenya shows actually the role model that Kenya is playing in bringing SDG 17 into practice. The SDG Partnership Platform, Kenya has been co-created and launched in a very close collaboration between the Kenya government and the UN system, together with the private sector, civil society, academia, NGOs, actually to support the Kenya's development and specifically, of course, in the last 4 years in the Big Four agenda. And of course, the main reason for that is indeed to bring intellectual and capital and financial capital actually together to ensure we translate those ideas into transformation or into support towards the SDGs. And I think we have made quite some progress despite indeed what we are facing at the moment. And what is very important, of course, is that if we look to the ideas that we are sitting on, and often we face indeed the challenge of moving those ideas from pilotitis, I would say, to scale. As SDG Partnership Platform Kenya, we took a multi-dimensional approach actually to support the collaboration. and adopt innovations that are key for providing access to affordable quality care for all. And I think this is one, of course, of the big 4 agenda topics and one of the SDGs that actually we will be facing for the coming decade as well. And the 4 dimensions that I would like just to briefly explain that are related to service delivery as the first one. And with that, what I mean is, of course, those ideas that we are talking about, how do they actually match when it comes to priority, when it comes to actually opportunity space, and when it comes to attractiveness with respect to business viability. And with the support of the many partners in Kenya and with the Kenya Healthcare Federation, Strathmore, Duke, McKinsey, USAID, actually multiple partners that we have been indeed looking into this space and assessing the opportunity space, and where we see indeed the number of opportunities that can address the challenges that we have been hearing this morning. So whether it is related to the human resource, or whether it is related to the infrastructure or to the supply chain, and of course also to the manufacturing within this space as well. And sizing the opportunities, of course, is one thing, but making it actionable is very important. And we have been also pleased to work closely, of course, with Strathmore. And again, I will also mention Frank Wafula, of course, and the work we have been doing in policy and the PPP or public-private collaboration space in building capacity and supporting indeed the strategy. And having this pipeline, of course, requires that, and requires, of course, it will not fly without actually building that strong strategy and policies for that. And the focus also has been on how do we build then toolkits to actually support capacity building in the counties and also at a national level, and how we ensure that actually we have strong pipeline that really matches the needs and also meets, let's say, the requirements from the different angles to be viable also with respect to financing. So having the ideas next to the capacity is very important. But the next one, of course, which is the 3rd dimension, and that is the financing, let's say, instruments and the mechanisms that are very essential, of course, for our development agenda. And that is, again, an opportunity next to, let's say, the public and the domestic resources that we can free for this is, of course, to attract the needed private capital for large-scale implementation, but also to attract, let's say, philanthropic capital to de-risk and incentivize the impact. And this has been a very key exercise, and I will come back to a few, actually, you can say results, intermediate results, the actions that are really taking place on the ground, and promising one as well, actually, to move in this space. But first, maybe also the 4th dimension, which is also very important for our Kenyan space, and I think that is a model that's absolutely relevant for our continent as well. And that is the how do we structure indeed the collaboration along the pipeline and bringing the intellectual capital together, and how do we twin the Silicon Savannah with the Silicon Valley or other regions and ensure that we have a continuous dialogue and also continuous structuring of transforming ideas into sizable opportunities and implementations on the ground, and making sure that actually we really support then the agenda the way we want. It is not about the ideas. I think we have many. It's really about bringing them, de-risking them, and bringing them into reality, and ensuring that we are connected to actually the investment and the financing mechanisms that need to support it. Of course, also the intellectual property to ensure that we have success at the end and the impact that we all aim at. And few examples that I would like just to mention. So we just recently actually designed the world's first 7 million HR, let's say, adolescent sexual and reproductive health development impact bond, which will be very, very key actually to de-risk innovations and opportunities and support them to scale. The discussion indeed around manufacturing and around the local vaccine production. We have been indeed supporting also the technical and the coordination and ensuring a 30 million investment. Also, other aspects that we have been doing, it has been a learning journey actually for all the partners together from the start, where we worked closely with the counties and supported them, let's say, in building the capacity, but ensuring that innovation can bridge some of the gaps we see on the ground. And one of the examples is what we have been seeing in Isiolo, where, and that is the case also for other counties, where we see the potential of what telehealth on paper can be, is actually also a service delivery that can really bring access to the people who really need it, and connect without making the environment necessarily attractive to bring human resource to the place. We can bring the service to the place. And I think that is very important. Thank you.
Let's give Daktari a warm round of applause. Thank you very much. I think the take home is that partnerships are possible and it works, and it's important to learn lessons from existing ones and apply them where necessary. Thank you very much, and thank you all of you for being attentive.